right, so this is the InBody 580 analysis result sheet or printout that you get after you complete the analysis on the scale. This takes a couple of minutes to do that, and then the report prints out. And so this is the information that you get, and you can see there's just a ton of information on this sheet overall. Here at the top, obviously, is the identifying information for the person having the test done. Then just below that, we're kind of going to go down the left side here. There's the body composition analysis. So here you get a good detail on intracellular and extracellular water, where you're holding the water. You want to have a good value of intracellular, but you want to have that balanced with water outside the cells as well. So this could give you an idea if you're dehydrated or retaining fluids. You can see on this example the total body water is 103 and the expected range is 83 to 102, so they're just slightly above that. So possibly retaining just a little bit of fluid, which is not bad. That's the next section. There is the dry lean mass. And over a little bit further to the right, your fat-free mass. And then below the dry lean mass is the body fat mass. Slide over to the right and you get your weight. So this is just a quick way of looking at all these values and comparing them. So then the next section down here is muscle fat analysis. And you can see there are 3 sections of the results there. There's a gray area with a down arrow, and then a slightly darker gray area with a dash, and then a gray area with an arrow pointing up. So the down arrow is if your results are in that range, they would be below expected or below ideal. If they're in the dashed area, they would be in the appropriate range or ideal range. In that section with the arrow pointing up, they would be above the ideal range. So you can see on this example, the weight is slightly above, the skeletal muscle mass is slightly above, and the body fat mass is slightly above. That is not too bad, but there's some things they could work on. So in a perfect world, you want the ends of these bars to make a D shape. So you want the skeletal muscle mass to be higher in proportion than the weight and then the body fat mass. You want the weight and the body fat mass to be lower in percentile. So you can see it actually gives you both the number of your weight, so 179 for the weight, but then it also gives you a percentile, so it's about, I'd say, 120th percentile. And then like for fat mass, 38.5 pounds of fat, and that is for this person, this age and sex and height, their body fat mass is a little bit higher than it ought to be. That gives you some information. You definitely don't want that result to be in the shape of a C. You definitely don't want your weight and body fat mass to be significantly higher than your skeletal muscle mass. So this can give you an idea of where you're at just in general as far as skeletal muscle and body fat. So kind of another way of looking at the BMI, but you actually have hard numbers to look at with the fat and skeletal muscle. So then it gives you a very general obesity analysis in the next section at BMI and percent body fat. Again, another way of looking at this, and it gives you your ideal ranges. So percent body fat here, 21.5%. You want that to be, for a man, you want it to be 10 to 20%. So this person is a little bit above ideal for percent body fat, but not too bad. Then the next section down is the segmental lean analysis. So this is basically your segmental muscle analysis. So this is in segments. So this is where you have your muscle. It tells you how much muscle you have in each arm, in the trunk, and then in each leg. And this, in a perfect world, the endpoints of these should be in kind of a straight line. You can see this person has a little bit more muscle in the upper body than they do in the lower body. The lower body's still in the ideal range, so it's not bad. They don't have too little muscle. They just have a disproportionate amount of muscle in the upper body, which is not the end of the world. But I would say this person, if they wanted to increase muscle mass, they should target the legs. I think that would give them more benefit, bring the leg muscle mass up, and that would be more beneficial for them. So you can look at that. This is really good information on where the muscle is, not just how much muscle you have. So move on here to the next section. Extracellular water related to total body water. And you can see this person's in a good range again. This is a measure of hydration. And then the next section down, the last one on the bottom, is the body composition history. And this just gives you a quick look at your weight, skeletal muscle mass, percent body fat, and extracellular water to total body water ratio. And you can look at that over time. So if this person had a second test done, it would be in the second boxes here, and that would compare those two. So you would know how much each had changed with a quick reference. Really a lot of good information on the right side of this report. So it gives you an overall score. I believe this is out of 100. So this person's score is 80. Just an evaluation of body composition, so muscle versus fat and the levels of where they're at, things like that. So 80 is a pretty good score. Then you go to the next section, and this is one of the most important sections on this page, the visceral fat area. So this is how many square centimeters of fat that you have in the abdomen or in the viscera, which is around the organs. And that is where you don't want to be fat. That means you're fat on the inside if you have a lot of visceral fat. So you want to stay below 100. You want your visceral fat area below 100. And then you can see it does go up naturally as we age. So when you start out, when you're 20, most people don't have a lot of visceral fat. We build it up as we go through life. And then you can see this person, they're about 47. And so their visceral fat's 83. So they're in the below 100. They're in that lightly shaded area, which is where you want to be. You don't want to be off the chart. That would be too far out. Definitely would need some work to correct that. So then the next section is the body fat and free fat mass control. So this is basically a recommendation on how much fat you need to lose. So this person doesn't have a lot of, they don't need to worry about their fat-free mass. So their muscle and other areas, those are pretty good. They've got a 0 pound recommendation on that. But if you look at the body fat mass, it's minus 13.7. So this person would be in much better shape if they lost 13.7 pounds of fat. They don't need to lose necessarily 13.7 pounds total. They could gain some muscle and that would be good, but they need to lose 13 pounds of fat and they would be in really good shape. So the next section is the segmental fat analysis. And this is similar to the segmental lean analysis. So it tells you where the fat is at. So here in this person, again, their arms have a little bit more fat than their legs. And then in this individual, the trunk is where they're carrying the majority of their fat, the most percent. You can see 21 pounds of fat in the trunk. But if you compare that to the visceral fat area, which is also in the trunk, it's on the inside, the visceral fat area is below 100, but their trunk fat in their fat analysis is high. That means this person is fat on the outside of the abdomen, which is a whole lot better than being fat on the inside. So that type of fat is not necessarily unhealthy. It's good to be lean, there's no question about that, but if you have extra fat, you definitely do not want it in the visceral area around the organs. And so then it gives you just some estimates here. So your basal metabolic rate, 1,751 kilocalories is their basal metabolic rate, and it gives you a range of where that should fall. So they're in the range, just barely, but they're in the basal metabolic range. It gives you an estimate of arm circumference, total body water to free fat mass index, and then a skeletal muscle mass to weight. So 44% skeletal muscle mass over their weight. All right, so lots of different ways of looking at this and a lot of good information here. So if you're interested in getting an InBody analysis, come on by. We've got them. Typically charge $10 for that. That's a really good deal. Most places charge $30 to $50 for this analysis. You don't have to have an appointment. You can just come in and see us. So if something like this is of interest to you, you're beginning a weight loss journey and you want to get an analysis when you start, see where your starting point is, and then check it later to see how well you're doing, this would be good. Also very good if somebody is trying to lose weight and they're doing everything right, but their weight hasn't changed. You could compare these two time points on the scans and see maybe you've gained muscle and lost fat, and that's why your weight hasn't changed. You would know if you've changed, if anything has changed. So you could really get some useful information from that. So anyway, I appreciate you tuning in for this and look forward to seeing you in the next video. Thank you.